full of stress and worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
Commendable Global Recognition Award was received by Dr. Navdeep Sharma and Dr. Monica Sharma on behalf of ND Care Nirogam Private Limited for leading Ayurvedic services at the British Parliament, UK.
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कंट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
Dr. Navdeep Sharma has also been awarded the title of Pranacharya by the Akhil Bharatiya Ayurveda Mahasammellan.
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद रहे।
नवदीप शर्मा को विश्व के सबसे युवा प्राणाचार्य की उपाधि मिली है। अखिल भारतीय
Namaskar and a very warm welcome to all of you in this live interactive session of ours where we join you all for quality Ayurveda. This always comes in the mind of parents. Some of them will feel that if we are taking herbs, why ABA? Some of them will feel that if we are going to a nearby center for getting a ABA therapy done, do we really need to be taking the training for ABA from you guys, and why? What is the difference? So remember, when you are going to a center which is nearby your place, with due respect to those centers, what they will do is they will ask you to leave your child with them, and then they will take your child inside and they will start command based learning for your child. For a child who is not at all having any eye contact, for a child who is severely autistic, that command based learning intermittently does have some benefit. But if we feel that that command based learning can bring a child out of autism, out of this phase, no, that is practically impossible. That OT session, that special education which you may be going for near your home, and they may claim that they are doing ABA also for your child, although that is not possible to be done without involving the parents. But still, when they are going for those things, yes, a bit of eye contact, a bit of small kind of things, they may improve. The child will become a bit responsive. The child may learn a command based few words. But if we talk about ensuring that a child comes out of autism, now that is something which is not going to happen with someone doing the therapy for your child. That is why the ABA, applied behavior analysis. Now analysis is the most important over here, the most important, because that is something which is generally missed by psychotherapists. They do the same set of things for every child, and that is not going to give output. So what happens is, in our ABA sessions, we ask the parents to give the maximum of videos of their children to us. We analyze, our team analyzes, they are on video calls with the parents, and in cases where the parents come to us, they spare out some time and be there with us. We analyze everything according to the individual behavior patterns of the child. Now we start training the parents, the grandparents, and all those who are there around the child. And when that training starts, that training is really very important, because if we want to bring the best out of your child, we need to behave in a proper way with the child. Even let us forget for some time about autism. Let us think about a normal child. A normal child where the parents are listening to everything which the child is asking for, the child is absolutely normal. But if the child will be pampered too much, you will see a child lying down in a shopping mall for the parents and demanding something to be given. A normal child also may start scratching or hitting the parents, especially the mother. So there are multiple problems which can be faced in a normal child. So in autistic child, that is nevertheless different from that. In autistic child also, if the training for the parents is not perfect, because an autistic child requires special management skills which are different from each child and depend upon the behavior analysis of the child. So that analysis is very important in ABA, and when that analysis is done, it's then that we start training the parents over there. And the herbs which we are giving to the child, the herbs modify the behavior of the child towards a positive, learning, acceptable behavior. The cognition improves, the child's concentration improves, the cognitive skills improve with the Breno R syrup of various varieties which you are now watching on your screens. With various kinds of Brenoirs, these skills improve. This Brenoir may be in a syrup form if you are visiting me in OPD. There may be Brenoir capsules if your child is of a age where the child can take capsules. Then there may be Brenoir mild, again a separate variety of Brenoir which we use where the hyperactivity is less and we target on speech, ignoring much of hyperactivity. It is only mild hyperactivity. And then there may be Breno A syrup. Again, when we talk about Breno A syrup, now this is a syrup which we use when we only need to increase the speech of a child, and the child otherwise is a very sedated child. The child remains confined to a side. There we use Breno A syrup. Again, we have Breno A capsules which we use when we need to enhance the learning skills, and we use it when the child is of a higher age and still is not able to speak but is not hyperactive. And there are various other varieties of Breno R which we use.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो।
कलर करो, वेरी गुड पार्ट, कलर करो। नो, इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड पकड़ो, हैंड, चलो, वेरी गुड, खाओ, वेरी गुड। हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है, मेरा बेटा 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। हमें एक सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है। भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत एक पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी निरोगम।
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep.